You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is one of the Bay Area's go-to implant dentists, Dr. Gavin Ewing. Dr. Ewing, welcome to the program.
Thanks, Randy. Appreciate having me on.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible. But for people that don't know your practice, like who's the typical implant patient?
We have a few different types of patients that come to our office. First one I would say is the person that's just been having a lot of dental challenges. They've been having toothaches, they've been having root canals, having to have extractions. And just over time, they start noticing that they can't quite chew the way they want to, or that their smile is not where it needs to be, and they're starting to have to kind of hide their smile. And somebody's told them that, they're probably heading towards a denture, but they don't want a denture. I mean, they don't want removable teeth like that. They're looking for an answer. And so we're happy to give them some information. So the great news these days is that we can give them a new set of teeth fixed on implants in as little as a week often.
Okay. You say as little as 3 visits. Is that right? Like you got to meet them and then you take measurements and then they get their teeth. Is that right?
Absolutely, that can be right. But this is a massive transformation we're making for patients. And if it takes a little bit more time for that particular patient to make sure that they're going to be absolutely thrilled with their smile, we'll also give them those extra visits to make sure that we follow through on our promises. Now, the second group of patients are those patients that have been in dentures, often even for decades.
Okay.
They've kind of checked out from dentistry. They had all their struggling and their, what led them to that denture. And they've been enjoying kind of having a little bit of a break. But they've also noticed the denture's getting looser, they're getting sore spots, they're tired of using glue. Their grandchildren are asking about what their teeth look like. And they want to get a little update on what's going on in dentistry today to see if we can get them some teeth. And the great news is with our new techniques and our experience that we have at our office, we can always end up giving them a great implant option to give them new teeth instead of dentures.
And we've talked about this. You say the denture wearer could literally, on the day of the procedure, can walk in with no teeth, walk out with upper and lower teeth that you literally print the teeth in the next room in the same day. Is that right?
Absolutely.
Is that rare? Or you...
No, this is what we do.
Okay.
We're not pushing the limits here. This isn't heroics where just one lucky patient gets an amazing outcome. This is what we do every day, and we really are able to predictably make our promises and print people and deliver teeth the next day.
Okay, good. Now, you're one of the few guys in the country that has a robot that helps do the surgery. Is that true? Is that a bit of an overstatement? But
Absolutely. Okay. I think there's only like 150 in the entire country right now. And I'm really proud that we made this investment in this technology. Ultimately, if I'm going to be doing surgery, I want to be doing as little surgery as possible. I mean, I know that we have to perform these procedures, but I want to make my procedures as comfortable as possible, as accurate as possible.
So less cutting, less opening up of the gums with the robot.
I mean, traditionally, if you needed to figure out where the implant's going to go, you have to look. You got to see the bone, so you have to open up the gums all the way to see the bone. But now with the robot,
is that right? Okay.
Yeah, I'm planning it digitally. I get to practice the surgery before I do it for you for real. And it's almost like having X-ray vision. I got a heads-up display, and I got this guided arm that really makes sure that I'm going to where I need to be. I'm not going to hit nerves. I'm not going to do anything off angle. It's still me doing the surgery. I'm still right there with you. You just get my absolute best to make sure that I'm giving you those teeth, and that the next day you're going home with new teeth. It's been exciting.
Now let me get this straight. Correct me if I'm wrong. How dental implants are typically done is you go to one doctor that does the surgery, another doctor that puts the teeth on top, and then they get maintained elsewhere. You do all 3 parts. Is that why you do it so quickly?
Yes, that's definitely a big part of why we do it. But it's really more than that.
Okay.
What I really love about it is that myself and my team, we take you start to finish. So every little question you have about the look of the teeth or the implants, I know everything you've been telling me as I take care of you, and there's no failure to hand off. There's no communication breakdown. The other thing is, it allows me to give you a really straightforward presentation. It's one office, one doctor, one game plan. I make my commitments to you, it's clear, and we just take you from start to finish and get you your teeth.
People like that. Is that right?
I mean, people like
going
it.
to one place, because nobody likes going to the dentist, right? Do you ever hear that?
Yeah, I mean, it is something
we hear. No offense,
hear.
doctor, I don't like dentists.
We do tend to hear that every day, but it's understandable. People don't want pain, and people don't want surprises. And dentistry is never going to be anyone's favorite place, but I do think it's my duty to try and make it as easy as possible. And like you said there, by bringing all those different sections of this process together, I have more control to make sure that we're really trying to do everything we can to make it as easy and as painless as possible for our patients.
Now this lab, by the way, so typically when you make these teeth, you send it out to a lab, but you have like a digital printer that prints the teeth in the other room? Is that an exaggeration or that happens?
No, it's wild. I love it. It's such a great service. We're literally printing them next door, and Melvin is staining them and characterizing them, making them look as natural as possible. The other benefit is that if anything needs to be changed, and instead of having to go with like a converted denture, like some old techniques, like we literally can make prints and just adjust your teeth as we go.
Like just press the printer and make a new set of teeth.
So it's like, hey, I want this one to be a little bit longer or these a little bit shorter. Instead of having to wait 4 or 5 months for your implants to all heal, we just print you some new teeth, switch them out, that by the time your implants are ready to go, we already have the perfect teeth for you.
Okay.
We copy them, and then we make your final zirconia teeth. And it's just an amazing way to make sure that you're getting the best version of your smile you possibly can.
Now, is it true it's planned on a computer? Like you do the surgery in a way on the computer first?
Yeah, so we have a fully digital workflow at our office. It starts with a virtual smile design. We then take that design and put it into our robotic planning software, and then I practice your surgery in advance. So I really know every little detail about your surgery.
Do they get to see what it's going to look like in advance?
Absolutely.
Like what it could look like?
Absolutely. They come in, and during their pre-surgical visit, we can show them their teeth, or if they just want to keep it easy and they trust that, you know, we're going to give them their best smile, we can make it easy for them too and show them on the day of their surgery.
Okay, good. Let's take a look at some of the photos.
That's cool. So here we have Jacob. So Jacob came in, and he'd had a really unfortunate incident at work. He works in a wine bottling company, and part of the machinery had injured his teeth.
Okay.
And ever since then, he's been kind of missing some teeth, having a hard time chewing, and he's been sort of hiding his smile a little bit, holding himself back a little bit. And, he's dealing with healing from his injury, but now he doesn't have the smile that he used to have. Historically, his option would have been a denture, and that would have been unfair because, he got injured at work, and a denture's nothing like teeth. And so the great thing about implants these days is that as we help repair a situation, we give him new teeth. And so
those teeth are extracted, couldn't save them. And he gets upper and lower teeth that don't come out?
Yep.
Supported by implants?
Yep. And the first time I looked in that mirror, I've been trying to have him smile when we're doing our records, and he finally started to step into a smile. And I think you can see here, like, he's on his way.
Yeah.
But
looks good.
He's a new guy. He's more confident. He comes into the office, he's smiling. Everybody loves seeing him. And so, we thought he was just a timid person, but that wasn't him. That was him trying to hide his smile, and now we get to really meet the real Jacob. And
you say you give them teeth and they act differently. Is it because just self-confidence?
Well, you got to think about it. Like, unfortunately, people do look at smiles. Like, people judge people by their looks these days. And so if you're having to hide your smile, how confident can you be?
Okay.
I mean, if you're trying to talk to people or you're trying to reassure people, putting on a smile is like how we communicate to people.
Okay.
And so if you're having to hold that part back from yourself, like you can't really let your energy out all the way. And so it's just been really awesome to be able to help him be able to communicate better through his smile. And this isn't just a once or here and there type of situation. This is really what we see routinely on our patients.
Okay.
You're going to see as we look at some of these more cases that when people can really lean into their smile and embrace their smile, it changes their whole demeanor.
When you say lean in, mean they just start smiling more?
Yeah, they start smiling more because they're not having to hide their teeth anymore.
Okay. So it seems painful, though, this implant process. What's that like?
This is not a painful process. During the procedure, I guarantee that you're going to be profoundly numb.
Okay.
What's more, we're going to give you a little bit of IV sedation. You're going to be a little bit sleepy. You're not going to remember the procedure. And we're going to be making sure that you're as safe as possible all the way through the procedure. We keep an eye on your pulse ox. We got your blood pressure. And we're making sure that you're comfortable. What's more, living with teeth is often what's painful. People come in and they've got a toothache or they've got bleeding gums. There's a reason that we're helping these people. And a lot of the time people come in and they're feeling better after the extractions, particularly with our robotic technology. One of the main reasons I bought the robot is, even when we were doing these with traditional techniques, we were seeing a lot of bruising, a lot of swelling, and some discomfort. And one of the most exciting things about the robotic technology is now we hardly ever see bruising or swelling. Patients come in the next day, they're able to smile, they're able to enjoy their teeth, and they're already starting to get that more confident smile.
So is it less cutting? And because it's less cutting, there's lower downtime for the patient and discomfort?
Absolutely.
Right? Do you give a medication if they need to the next day? Or do they take over-the-counter remedies?
Yeah, I mean, we're going to make sure every patient is comfortable, but particularly since we've been using this robotic therapy, most patients are just using Advil or Tylenol, or they're saying that they don't need anything. They're feeling better.
How soon can he eat when it's all done?
You can eat the day of your surgery after we give you your teeth. I mean, obviously eating's part of life. Like, we're here to make this as easy as possible for you. We do ask you to take it a little bit easier.
Okay.
But absolutely, you're going to be eating the day we deliver your teeth.
So how soon can somebody like this eat if everything works out?
You can eat immediately, but we want you to take it a little bit easy. But before you know it, you're back to eating sweet corn, steaks, sandwiches. You can even bite into apples.
Do you have to be careful with the front teeth, biting in like a raw carrot, or anything you can do with regular healthy teeth you can eat? Is that right?
Our goal here is we're making you teeth. We want your teeth that we finally give you to act like teeth and to be able to eat all the things that teeth normally would be able to eat.
How old can you be? Like the higher ranges, how old can somebody be to get this done?
We have patients in our practice that have done this procedure that are 85, 88. And so there really is no age limit to dental implants.
Why would an 88-year-old want to do this?
I mean, heck, what are you doing at that time? You're hanging out with your friends, you're going to the diner, you're eating. When you're traveling, do you want to be carrying around a box with your teeth that you're putting on the bedside stand? No, you want to be enjoying the food in Italy.
Okay.
There's being able to talk without having your teeth move, or being able to laugh without having to worry about them, popping out. Like, there's really no age limit for being able to make use of your smile and not have to hold yourself back.
So when a 75-year-old comes to your office and says, I don't know, doc, I'm too old, it's just not true?
Absolutely not true.
Okay. Yeah, but what if you're on like type 2 diabetes medications? Or, because look, statistically, if you're over 70, you're on 4 medications. So can they be on medications and still get this done?
I would say most of our patients that we do this on every single day are on several medications.
Okay.
It's our job to help optimize these patients and make sure they're going to be healthy. And so some cases, if they're on the more challenging side, we'll work with a medical anesthesiologist. But routinely, every single day, we're helping out patients that have a complex medical history. And again, because of this robotic technology, our surgeries are less invasive, and so there's less healing they have to do. And so it just makes sure that we give them a smooth experience. Let me show you this next patient.
All right.
Here's Brenda. Take a look at her before photo. Her and her husband compete barbecuing, and so she was talking about how she was starting to have a hard time tasting her foods, chewing them up properly. But then on the side, she kind of mentioned that she also had this like fashion design company that she's doing where she makes custom denim rock jackets.
Okay.
And we kind of heard about that a little bit at the beginning, but she was tired of not being able to eat. She was hiding her smile. I mean, you can see how she's sort of not really smiling all the way. She's giving a sort of a social or controlled smile. And she knew she was ready to make an improvement on her smile. So she let us go ahead and help her out with just that small part of her look. And I can't wait to show you this after, but this is her.
Wow, okay.
Like, check that out. Like, when I look at that, that just pops to me.
So those are teeth supported by dental implants?
That's teeth.
Is that right?
That's teeth on top that are supported by dental implants. For me, this is a fun experience because, like, I did my small part.
Okay.
Like, I got to give her the teeth, but let's not be wrong. She's a fashion designer. She knew what she wanted. She wanted white. She wanted them to look a certain way. And through the powers of digital smile design, we were able to really curate and customize the teeth to the ones that her vision were. Not just a copy-paste smile that that we think she needs. She got the teeth that she wanted. So she came in that day, and she's been leaning into her Instagram marketing. She's been talking about her jackets more. I definitely can't claim her artistry, but it's pretty satisfying that I got to be part of giving her at least the smile side of things. Now, I wanted to have you take a look at her teeth. Those teeth are for her. Like, those are completely customized to her sense of style, her facial proportions, the size she wanted, the shade she wanted. Those teeth wouldn't work on an 80-year-old man.
So everything is kind of customized based on, what your computer figures out how to make it perfectly fit the mouth?
It's not even just kind of customized. It's like fully designed.
Okay,
she was able to come to us with like pictures of celebrity teeth that she really liked, and we're able to show it to her in a digital pre-design. And then because we have the printer, we did go through a couple of different options for her.
So she wanted to look like a specific celebrity.
Yeah, and she got to try it out. Instead of having to start over from scratch with like a denture, we just print out little changes for her. So we probably did like 4 or 5 different versions for her because we knew that when we really got it right for her, she was going to love it. And like, look at the outcome. Once we got to the teeth that she vied with, like,
she looks like a different person, by the way. I think anybody would agree with that. right?
Yeah, and that's her. Like, I did our little part. She had our sense of style, but once we managed to like make her smile come in harmony with the rest of her vibe, like, it's magic.
Do they have regrets? Like, I should have done this a long time ago. Do you ever hear that?
We do hear that. Like, people obviously are anxious because, you know, they've had negative experiences in the past and there's fear involved with this. But once we've taken through a smooth experience, like, this transformation is happening in as little as 2 or 3 visits. It's not like old school dentistry where you're going in for a 2-hour root canal, then you're going and getting a crown from like another dentist and you're bouncing around different offices. You're having all these challenges. Like, people come in thinking it's going to be like this Herculean effort to have a solution for their teeth. And we know in 2 or 3 visits, they get a full set of teeth, exactly the style they want, and pain-free with the help of sedation and appropriate pain management, that it doesn't have to be that hard. And so, yeah, they're like, geez, well, what was I should have done this a few years ago.
What if you have bad gums, like gum disease? Can you still do this?
Absolutely. 70% of patients who are going to lose all their teeth lose them from gum disease.
Okay.
Most of our patients that need this treatment is because of gum disease.
Okay.
And so by taking out the teeth, we clean up all that infection. The body heals to where it's going to be healthy. They have pink, healthy gums. They're no longer having bleeding gums or moving teeth. And they go home with a new smile that's fixed on implants that they can treat like teeth.
Now, you're a dentist, so you probably think like the most important thing is a smile. How important is a smile in your opinion?
You know, it's not just because I'm a dentist. I mean, look at society. Like, if you're trying to communicate that someone's a villain, they make their teeth grayer. Or like, if you've seen that billboard where you're missing one tooth, like, it just draws your eye to it. Like, people have a tendency just to look straight to the eye, or to the teeth rather.
Okay.
And I was like wondering what that's about. And, you know, there's research that tells us that 90% of communication is actually nonverbal. 90% is more about your body position and the way you look than the actual words you say. And so if you're having to hide your smile, you're not able to communicate and give your message the way that what you're actually trying to do. I mean, people come in and like, they think, oh, people used to think I was mean or I was kind of grumpy.
Is that right? Okay.
Yeah, and then we stop them from holding themselves back. I mean, this is really all we did for Brenda. We just allowed her to let herself out and look at the result we got.
It is a big difference.
Yeah, so, you know, the smile is important, but so are your eyes, so is your attire, so is your whole vibe. But if it is a part that if it's holding you back, it's holding you back. And
so if you don't like something about yourself, it holds you back.
It does hold you. And, if you're feeling a little bit insecure about it, like, if you can't smile, you just think about when you smile, how good you feel. Like,
what do they like more, what they can eat or how it looks?
That's one of the most fun things for us. You have the guy come in and they're like, I'm just tired of loose teeth. Or like, I have a chicken wing and it gets stuck between my teeth and now my gums just start aching. But, I'm a cosmetic dentist that does surgery. So like, I'm going to make sure those teeth look amazing for him. We give him his teeth and then 3 months later we see him for a cleaning. And all I can talk about is, taking photos with his family. Like, he's walking in, huge
So first
smile.
he wanted just to eat and now he likes to look.
Absolutely. And then, you have a lady, she's very health oriented. She's got, teeth that have been letting her down. And, she doesn't want to have the broken down teeth. She wants to make sure her smile is going to be dialed in. So we get her set up. We give her that smile. And then, 3 months later, what do you think she comes in talking about? She's talking about, I can eat an apple again. I can eat a salad. I can grind my foods.
That's nice. Okay.
Like my doctor says, like my blood sugars come down a couple points because we all know how hard it is to maintain a diet, even when you have regular teeth. Imagine if you can't chew. So that person is excited to be chewing. And so like, that's the fun game. It's like pretty much every patient, they end up appreciating both sides of it. And that's part of why it's such an amazing service to be able to help our patients with.
So we're short on time, and I know you brought some more photos. Let's try to get as many of those as we can in.
All right, well, here's Cheryl. She'd been wearing a denture for 20 years. She thought that was our only option, but then her grandchildren started asking her about her teeth. And one day we were able to give her new teeth on top and bottom with implants. And just look at this. Look at how it brought her alive. Like, look at how much wider her smile is. Look at her eyes. Like,
I could see that.
It looks like it really helped her be the best version of herself there. Here's Dan.
All right.
He had started getting some missing teeth and some loose teeth. And he had done a little bit of research. And he said, I've seen implants and a lot of the time it looks like a denture. I want to know that my teeth are going to look like me. I want to look in the smile and still feel like me. And so he has like a slightly narrower formed to his teeth. And because of the 3D printing and the digital smile design and my background as a cosmetic dentist, we were able to give him, the day after his surgery, a set of teeth that he looked at in the mirror, he's like, that is me.
Looks good. Looks good. Now, is that kind of a challenge for you? Like somebody, I mean, that's like right up your alley. A patient comes in and explains, I don't want denture-looking teeth, or I don't want fake-looking teeth.
I mean,
does that give you a little bit of excitement? Like, because that's what you do.
I'm about.
Yeah.
Like, that's the fun. I mean, just throwing in implants and doing surgery, like, okay, once you've done enough of it, it's pretty routine. It's very predictable. But like, the fun is, helping find that characterization of the teeth that makes the patient look like themselves.
And these can last forever. Or just like regular teeth, as long as you take care of them.
As long as you take care of your teeth, these are designed to last you the rest of your life.
Nice. Okay.
This is another one. This is Jennifer. And this was kind of sad for me. She had gone to a clinic and she had had her teeth taken out and they didn't even give her a new set of teeth.
No denture, nothing?
Nothing.
Okay, wow.
And unfortunately, we do hear this. And so she was really excited about getting some teeth. And what did she want? She wanted it done quickly. She was ready. She had an interview coming up. She was, we were no more wearing masks. She needed some teeth to be able to smile. And so we were able to take her from records to new teeth in 1 week because of our digital workflow. Here's Esther. This is a case that I just straight up couldn't have done without the robot. She'd been in a denture a long time. Her anatomy there's only a little bit of bone left. And I still wanted to make sure that when she got done with the surgery, she was going to be getting fixed teeth that very same day.
That means teeth that don't come out.
Teeth that don't come out. And so I needed the confidence of knowing that when I plan my case virtually or practice the surgery virtually and then we use the robot to deliver those implants are going to go exactly where they need to be to make sure that I could keep my commitment to her and make sure that she walked home with some teeth that day.
Now, for people just tuning in, you use a robot to help guide your surgeries. Is that the right way to say it?
Yeah, absolutely.
So people that have limited bone, the robot helps you find that bone.
Yeah, it helps me. I mean, it helps me find that bone because the other way to do it would be having to see that bone. And if you have to see it, then you have to do
cut them open
bigger.
More.
Yeah,
they're gums.
Yeah, you kind of do. And so when I have the robot, I plan it digitally. It's almost like I have X-ray vision. I can make sure I can make sure that those implants are going exactly where they need to be without me having to visually see them. The healing times are quicker, and it allows me to do more cases that are more complicated and
Time
less
for a couple more.
predictability. All right, here's Robert.
All right.
He pretty knew he knew what he wanted. I mean, he'd done some research. He'd talked to some different choices. He knew he didn't want to have a denture, and he knew that implants might be an option, but he wanted it to be easy. He was ready. He had some time on his schedule, and he just wanted to get it done. He got himself ready, and he was ready. And so, again, this is another case that with our digital workflow, we were able to make it 2 visits for the surgery and deliver the teeth, and we were able to get him scheduled with the window he had in mind. He had taken some time off from work already. We're going to be able to line up. And
he wanted it easy. Did he say it was easy when it was all over?
He said it was easy. He said it was very little post-op discomfort. And look at him now. I mean, he's showing more of his face. He's smiling bigger. The teeth are the right shape. They're age appropriate for him.
He shaved the beard a little bit.
Yeah. I mean, we didn't ask him to do that. That's just the way they show up. This happens all the time. They just show up. And ultimately, I think he's a great example of what I like to do. Sometimes we like to do stealth dentistry.
What does that mean, stealth dentistry?
People don't want it to look like a denture. They don't want to look like they have something done. They want to be able to
get blistering white teeth, super white teeth.
Yeah, some people, they just want to have their version of their healthy teeth, and they want to have people come up to them and say, "Hey, did you do something? What did you do?" I was like, "Oh, I got my hair cut." But they know that they're reacting to the teeth. So they want it to be stealth dentistry. And so we can do cosmetic statements or we can do stealth dentistry. Ultimately, it's what you want, and that's what the digital workflow is allowing us to do. Here's Ken. Ken had been dealing with a partial, and it was just getting looser and looser and looser and looser, and he was kind of over it. In this pre-op photo, he looks a little reticent. He looks
like a tough guy a little bit.
Yeah, I could see that, I guess. But, again, he's holding himself back. And so for him, in one day, we took out his teeth, placed implants, and gave him new teeth on those implants. And look at him smiling now.
Totally looks like a different guy.
Yeah, and who's told me the most about how much of a different guy he is now?
Who?
His wife. Ken's a sweetheart. He's warm, he's charismatic, he loves his teeth, and it's just helping me help him in a small way to, help relieve something that's been bothering him. And I'm glad that I was able to help him.
How do people hear about you? Because I know you're all over the internet.
People do find us online, and a lot of people are told about us from our existing patients.
Okay.
We're an office where instead of having to bounce around to like 3 or 4 different specialty offices, we can give you one treatment plan in one friendly location with one team and one doctor that's going to take you from start to finish.
Now, we need to mention this because this comes up, I'm sure, about the money. Medicare doesn't cover this. Medicaid doesn't cover this. Even the best dental insurance only covers a very small portion. But you say people finance this.
Yeah, I would say about 80% of our patients do finance this. But we're a green light office. We're going to do everything we can to help people get the care they need. We do take insurances where we can. We're also willing to make plans, and we have a variety of different financing companies. And ultimately, we can do some dentistry to get you out of pain versus nothing. So it's still one office, one convenient team, one game plan, and we're going to make sure that we give you the best care that you can get for where you're at.
And you save teeth when you can, right?
Yeah,
because you were telling me that some places, just philosophical differences, that some places they do one thing, remove teeth, give you new teeth with implants, but you say that could be expensive. Elaborate on that.
So yeah, we absolutely save teeth when we can, but I think for most of the patients that we're talking about in today's appointment, what we actually do is we can help keep you healthy until you're ready. So instead of having no home, like, you have a toothache or you got a root canal, you're not ready. We've spoken about it. We know that your goal is to get there, but we're not quite ready yet. I get it. Like, life happens, but maybe something's going to change in the future. We invite you to be part of our practice where we'll take care of the emergent problems, keep you healthy, and then when you're ready, we'll be there for you too. Good.
Now, final message. Somebody watching this, they're the two categories. They have a denture or they're about to head to a denture. They've heard what you have to say, but for whatever reason, they're still afraid, or they're worried, or they think they're too old. What do you say to them?
So I would just really invite you to come in and have a chat. The first visit, we're just meeting, we're just talking about what's possible. You don't have to worry if you can know or not. We offer a free courtesy consult, and I can give you some really good information. Obviously, I'd love to help you out, but at least you'll know,
Okay, so know your options.
Know your options, and let's tell you about what we're doing today that is giving more people more options. And let's just start to make a relationship. If it takes a little bit of time for you to get comfortable, all good. We're here to help you, and we look forward to giving you information that you can benefit from.
What's the best place to make an appointment? Online or just call your office? What do you prefer?
We prefer if you give our office a call, because then you can start to get some better information from our team.
Okay, good. I want to thank you for coming on the show. Good stuff.
I appreciate it, Randy. Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.